Respiratory rate is a very important indicator of your patient's current health status. But at this early stage of the physical examination, only concern yourself with two aspects. Number one, first impression of whether your patient is in respiratory distress and needs urgent resuscitation, highly unlikely. And two, count and comment on the respiratory rate. Make sure you can clearly see the patient's thorax, preferably with top off and lying back comfortably at 45 degrees. Rather than stand there at the side or foot of the bed staring at the patient's chest for 15 seconds, I suggest instead to incorporate this step at the end of taking the pulse. This serves as a distraction and makes for a less uncomfortable situation, especially if you are the male and the patient is female. Because of time constraints, count breaths for only 15 seconds, then multiply by 4. Make sure you clearly state what the respiratory rate is and whether in the normal range. Okay, let's have a trial OSCE and count the respiratory rate for 15 seconds. Exam pitfalls. Trying to read too much into the respiratory rate and the pattern of breathing at this early stage. Leave detailed assessment and analysis for the formal respiratory system examination, and when you have much more information to go with it. The most common factors that can affect respiratory rate include emotional state, physical fitness, temperature, disease, and health status. Factors that can slow respiratory rate: drugs, especially alcohol, narcotics, benzodiazepines, certain severe brain injury, and hypothermia. Factors that can increase respiratory rate: fever, asthma, COPD, any form of ischemic heart disease, especially CCF, drugs like amphetamines, anxiety, dehydration. And the adult range of breathing is between 12 to 20 breaths per minute.